There are many different reasons for back pain, and that's the value of applied kinesiology. Back pain can be because of vertebral subluxation, misalignment of the spine. It could be because of a strained muscle. It could be a kidney irritation in the lower back. A back pain or neck pain can be because of a disc injury. Now, a disc is a spongy material that's in between the bones of the spine. What it does is it separates the vertebra, allowing the nerve root to come through without getting pinched. If you have a whiplash injury to your neck, if you fall asleep in a chair, I guess doing a whiplash injury as well, poor posture up here, in your lower back, if you're lifting something or someone improperly, slip and fall, almost slip and fall, any type of those structural challenges, the disc can come out of position and put pressure on the nerve root. Now, the concern with disc problems is that if left uncorrected, the disc can start to thin and degenerate, and that's what we want to prevent. It can go through a series of degenerative changes in forming arthritis, such that it can get to almost a pencil thin type of situation, which we certainly want to avoid, which would be like a disc herniation in a surgery situation. So I pay very careful attention to discs to make sure that they're handled carefully and appropriately. Now, a disc in the neck, in those nerve roots, they go down into the arms and into the fingers. And what can happen is that sometimes you can have pins and needles in your arm, or actually some arm pain or a loss of grip. Okay. So a disc problem can also be contributed to by a TMJ problem, or also for the upper trap. So that's one thing we check also. Sometimes when you balance the jaw, if you balance the musculature in the shoulders, it can take some of the tension off of the disc. So after we do that, after we check those areas, we check to see if there's a restoration of muscle strength. Because one of the things that you'll see with a disc injury in the neck is that you'll see a weak muscle strength. So oftentimes it could be the deltoid, so it could be hold strong here. That's nice and strong. But if you go here, you can see that that muscle goes much weaker. And what we could do is that when you take just traction up just a little bit, take some tension off the disc space, and then you go back here and then you test again, you can see it gets a lot more stronger. So that's what we want to do, is that if this doesn't work, if the TMJ balancing doesn't restore the muscle strength, if the restoration into the upper traps doesn't restore the muscle strength, we'll do some cervical traction. Basically what we want to do is that we want to open up the disc space and take some of the tension off the nerve root, restoring the nerve flow into the arm and allowing the disc to heal. In the lower back, the nerve roots if there's a disc injury in the lower back, the nerve roots go down into the legs and into the toes. So oftentimes what you'll find is that there'll be, when we muscle test, that there'll be a weakness in one of the muscles, usually the hamstring muscle. Can you hold your leg like this? Don't let me push down. Hold tight. That's strong. If we go over here, hold strong. That goes weak. If we just separate the vertebrae just for a moment, just allowing that nerve root to flow, decompressing it, taking some of the pressure off, just pulling it apart, hold strong here, and then it gets strong again. So the first thing that we do, and a person should do with disc injuries, is that we use an ice pack. Put an ice pack on the lower back, and that's the first thing that we'll do here in the office. And I'll let it be I'll do some other work on the patient, but we'll come back here and just keep checking it to see if we get strength back into the muscle. So after a period of time of working, I'm coming back, hold strong, and we can see that the muscle is still weak. After 5–10 minutes of an ice pack, then I'm ready to start using traction to decompress the area. In the lower back, the nerve roots go down into the legs and into the toes. Sometimes a person may have sciatica as a result of a disc injury or any type of radicular or radiating pain. This is what a normal disc looks like. And this is a picture of if you're looking up and down from a disc, such as in this type of pose. And you can see how it's even circumference all the way around here. In a disc bulge or a disc protrusion, due to some type of structural stress, what's happening now is that the disc is putting pressure against the nerve root there. And we're having, instead of it being equal here, now there's more force against one side here. Eventually, if it's not corrected properly, the disc can start to herniate, it can start to rupture, and then it can be a surgery situation. That's precisely what we're trying to prevent. Disc problems, disc protrusions, disc bulge, this is an injury, and all injuries have an inflammation. So for disc problems to heal properly, it's important in care of the lower back that not to sit for long periods of time, don't bend forward too much, don't twist, don't lift, don't carry, nothing real physical. And the general mode of approach to healing a disc injury is to ice pack it as much as possible. 20 minutes at a time, even once an hour. If there's a disc challenge with the neck, good neck posture, papers and books up, monitors at a good level. Don't put the phone between your shoulders and ears. Try to be nice to this area, mindful of this area, and the lower back as well, nice and easy. Sometimes supplementations can be helpful. We prescribe proteolytic enzymes. Proteolytic enzymes are designed to bring down the inflammation and rebuild the soft tissue. That's the difference between a proteolytic enzyme versus a non-steroidal medication that you would take over the counter. Over-the-counter meds, such as perhaps Motrin or ibuprofens, they bring down the inflammation, but they don't rebuild the soft tissue. Research shows that products such as these do both, brings down the inflammation, rebuilds the soft tissue, plus very much so you don't have the side effects that ibuprofen have of possibly hurting your digestive system. Our job is to get you out of pain and restore normal function as soon as possible. Thank you for listening to our segment on disc injuries. I'm Dr. Marc Terebelo.